October will be my 31st anniversary. And so we've seen quite a bit of children coming through our practice. I'm in an immigrant community, so a lot of these children, they are screened at school, and that's when they get the first notice that something might be off in terms of their vision. Or they might do a screening at their pediatrician's office, and then at that point, they'll get a referral to my office. That's basically how our network works, because predominantly our children are on Medicaid, and with Medicaid, it's a managed care system. And so once they get that report from a failed vision screening, then they are referred back to their primary care doctor, who then in turn will refer to me. It's been a very easy system to navigate in. Once I have the child in my exam room, that's my opportunity to educate them about the importance of vision care. But as I'm talking to the child, I'm not treating them like a child. I'm talking to them as if they're somebody that has this potential to grow and later on be the one that's going to be bringing themselves into the exam room. So it is my opportunity when it comes to back to school that they have to understand that vision is not just used to play video games. Vision is a way for them to learn. And so I really emphasize that to the child. Of course, the parent, usually the mother, is sitting behind me. And so she's listening. And I think it's very empowering when the parent sees that I am talking to the child with respect and as if they were comprehending everything. And of course, then later on, I will bring the mother back in to the conversation, but that's usually at the end of the exam. So after the exam, I bring the child back to sit next to the mother, and I'll do a summary of everything. And so back to school for my staff, it's actually a very busy season. Thousands of kids will come through. August, September, October. Usually the holidays, the children don't come in as much. During the holidays, it's going to be usually the parents coming in. It is a great opportunity for us to educate them and tie it back into learning through their eyes.
So you had mentioned, you practice primarily with an immigrant demographic. How does that demographic influence the different types of ways that you approach, especially patient education? But is there anything in particular that your particular demographic is more susceptible to in terms of like eye conditions or refractive error? And like, how do you look out for that?
My demographics is heavily an Asian and Hispanic demographics. And so we have high myopia, we have high astigmatism, but on the flip side, we also have very much high hyperopes as well. I know that right now the emphasis has been on the management of myopia in the children population, but at the same time, in my demographics, we also have high hyperopia. Learning comes predominantly from near vision, right? Up close vision. So when you have a +3 diopter hyperope, who they are farsighted, meaning their vision naturally is better for far, their weakness is up close. Can you see how much that potentially can be harmful if they're not corrected with their farsighted glasses? They're not able to concentrate and see well while they're studying or learning in school. So that has a huge impact. So my staff and I, we talk about this all the time, about the different types of prescription and the impact it can have on them learning in school. And we all know about the statistics, right? The better the outcome if they can graduate from high school in terms of potentially attaining a job and contributing to the workforce. My staff and I, we know every day that when we have an opportunity to spend with a patient, we never look at the patient's insurance. Of course, we have to, in terms of putting it into our system and in terms of billing, we have to identify what their insurance type is. But because 70% of my patient base is on welfare, I go in blind in terms of insurance. I do not know what the patient has in terms of insurance. I take care of the needs of each individual. And so that's how I practice in my community.
What do you see the interest in contact lenses looking for these pediatric patients? What age are you usually fitting, and what does that timeline and scheduling look like during the back to school season?
During the back to school season, I would say that most of the fitting is around probably the middle schoolers and obviously the high schoolers. Usually the high schoolers, by that time, they're the ones that are asking the parents if they can have contacts. But the middle schoolers, sometimes the conversation comes from me introducing the option to the parents, right? At the end, the parents are the ones that are going to make the final decision. I will always present to the parent why I am presenting it as an option, especially if the patient has a high prescription. We have great myopia control contact lenses that we can use and help manage the condition, but it's more the lifestyle of a student, right? If they're playing sports, or they're very active, that sometimes having classes gets in the way. And in terms of their performance in whatever activities that they're involved in outside of school. And so I do present that to the parents. Younger than the middle schoolers, we welcome all kids. You know, if they're like 6 years old, 5 years old, we will teach them how to put on the contact lenses and take them off. I know that sometimes if they're even younger than that, we'll teach the parents. But right now, I think most of the children, when they're educated, they want to be involved in the decision of wearing contacts. I do want to make one note. I always want to make sure that the parent is not the one that is telling the child that they need to be in contacts. The child needs to verbalize that they want contacts themselves, because at the end of the day, they are the ones that are putting them on, taking them off. And if they're resisting because mom wanted me to wear contacts, then they're going to be a little bit more non-compliant. And so we always want to make sure that the child does want to wear contacts.
Specifically, even looking at college students or the prevalence of some of the younger patients that are getting LASIK, how are you seeing those trends? You've been in practice for a long time. How has that changed, and where are we now in terms of interest and those younger patients looking at LASIK?
For me, at least at my practice, we do tell patients that are interested in LASIK that a lot of times it's not the children, it's the parents. They're asking, hey, can I have my child get LASIK? And the way I've been practicing, I've been encouraging them to wait at least until they're 18 so that they can make the decision, the child. But at the same time, I'm also emphasizing that the child, even at 18, can still be developing. The eyes can still be changing. And so sometimes if they go ahead and do the LASIK at 18, they might find themselves with prescription changes after the procedure. So I usually tell them to wait until after all that near demand is gone, meaning that if they are still planning to go to college or graduate school and all that, that it's probably best to wait until all that extra visual demand for near is kind of lessened. And once they start, working or after that increase of near demand during that period of time in their early 20s, but that's probably the best time to do it.
Is there anything else on back to school season, contact lens fitting, the LASIK piece that you wanted to touch on that we haven't touched on yet?
I mean, it's an exciting time for kids. I mean, they're can't wait to wear their newest outfit, their newest backpack, their shiny notebooks and all that. We try to think that the back to school season, really the attention that we put on the children, it really is throughout the entire year. And that vision is part of the learning process and it contributes to our economy. I always want to emphasize that it's not just a pair of glasses or it's not just a pair of contact lenses. Everything that we are doing is to optimize their visual needs so that they can perform.